Good afternoon, Galion. This is Mayor Tom O'Leary, back again with Galion Health Commissioner Trish Factor. I want to have Trish update you on information. Again, we try to use this YouTube channel. It's just another alternative to get information. Certainly the more traditional media is out there, but hopefully the information that Trish has today and willingness to answer a few questions will get everyone in the Galion area updated. So what do we have today? New information, I guess, of the unfortunate nature. Inevitable, but unfortunate.
Right, so we were notified today, Galion City Health Department was notified today that we do have a confirmed case of a Galion resident. And as many other health jurisdictions have relayed in their communications with the public regarding confirmed cases, we cannot give too many identifying markers there. We can say that the individual is in their 30s and is a resident of Galion. What our office is really tasked with is not only handling the care treatment, making sure that confirmed cases are getting the health care that they need, but then also contact tracing. That is one of our biggest tasks. So what we do is we interview the positive cases, and with those individuals, we find out where they've been for the past 14 days, who they may have come in contact with. And in doing so, we then continue on and track individuals down that may have been exposed to the person during the period of time where they were infectious. So this is something that we do on a regular basis with other diseases. So this is our yield house there. So it's where we're more comfortable handling things there. But it is very important to realize that yes, you may have come in contact with folks. However, when we do contact tracing, we are really focused in on individuals that maybe have been within 6 foot of a confirmed case for 15 minutes or longer. That's kind of our goal there, is individuals that are being contacted directly by the health department are going to be the individuals that fit into that category. You may have come in contact with somebody else. Again, if somebody works as a cashier, if somebody came in and purchased something from your business, we can't track every individual that way. Pretty close to impossible unless we're looking at cameras here and there. Sure. We don't have that kind of technology. Sure. But we do the best we can with the information that we're allotted. So I will say, along with that, one of the big things that I will ask all residents of Galion, anybody in Ohio, anybody in the country, consider where you're going and what you're doing at all times, okay? Because if you end up as a confirmed case, the health department will be contacting you, and we will be doing this kind of investigation. We will interview you and find out everywhere that you've been in the last 14 days. So if you can think back on where you've been in the last 14 days, are you proud of it, or would you be embarrassed at how much you went out? So when we say, go out for the essentials, do the things that you need to do, did you go out unnecessarily? Were you doing things that you really didn't need to do? Did you expose more people than what you needed to?
Yeah, that's a good point. Hey, let me make a quick point. I think that brings to 5, not that anyone's counting, but 5 Crawford County cases, confirmed cases with today's. Is that the right number? Might be a little bit higher at 2 o'clock or something.
Right. At 2 o'clock, we may not know exactly what the number is going to be, because another bit of information that's fairly important for folks to realize is we get this information real time and we're relaying it to you as soon as this happens.
Right.
This is within a couple hours of us finding out. For it to go into the state numbers that are relayed during the 2 p.m. Governor's press conference, the information has to be in by between 10 and 11 a.m. And into a state tracking system. Right. So this case may not be included in that, but it will be the following day. Right. So it is an ongoing, and I'm not sure if Crawford County Public Health that serves the rest of the county,
Right.
if they had any additional cases today.
But here's the kind of the point. So it's 5. Let's just say for a moment in time, it's 5. My recollection is that 3 of them, one's in their 20s, one's in their 30s, and one's in their 40s. So the myth that I think is being busted, I hope pretty quickly, relates to what Trish was talking about. Like, yeah, older people, myself, limiting contact and staying home as much as possible, honestly. On the other hand, I think young people got to be now aware that it are their peers who are getting sick, and that community spread and those other factors. But anyway, any comment on, our data, small set, is that 60% of the people are young people.
Correct.
So anything about re-emphasizing that, or anything along those lines?
I mean, I think the biggest thing to keep in mind is anybody can get this. When you look at the age ranges, at least in the state of Ohio, we have under age 1, so we have infants all the way up to, I believe it's 98 now.
Yeah.
But the average age, as of yesterday at 2 p.m., is 52.
Right.
That's the average age. That means there's younger and there's older. So nobody is immune to this.
Right.
That does not exist. There's no
so
immunity right now.
We have 40,000 people roughly in the county. We're older than average, but our data is coming back early on in this. Our people who have tested positive are younger than our average age. So the kind of like repeating the message, young people who may be thinking, or blowing it off, the severity of it, they may be stricken. And then of course, nobody wants to get their kids sick or their older relatives, friends and such sick. So when I saw that when you mentioned the age of this one, I thought, well, goodness, the last 2 coming out of Crawford County were what I would call young people. So I don't believe we can emphasize that enough. And I don't know, I heard twice this morning. Everybody's got a Facebook anecdote on it, somebody told me today they went out shopping and tried to do their limited thing, and they were struck by how many families were out, seemingly not. So I'm getting real tired of elected officials, politicians, a little less tired of public health experts, shaming us to staying in, but God, it's true. If you and so if this one individual in Galion, who we hope will recover and be all right, can serve as an example to anyone, it's in our community, no great surprise, but it's hit a younger part of our community first. And wake up out there. And I'll tell you what, I'll sit up in my chair if you guys wake up and stay in a little more often. How's that sound?
Well, and to your point, some of the things that we recommend to folks, and we really think that it needs to be driven home, like you said, you do need essentials. Okay, you do need to go to the grocery store. You do need to get gas if you need to drive to an essential job. You may have an essential job that you need to get to. We all do here, but it's very important to reduce unnecessary travel, unnecessary contact with individuals. If you have multiple adults in the home, don't take the kids to the grocery store with you.
Yeah.
Leave them at home. I know the kids are getting bogged down. They want to be out. Take them out in your yard and play. Playgrounds are closed down. You should not be on any playground equipment. We're also saying the same thing, basketball. Some communities are taking down the hoops because people are not listening.
Yeah, I really don't want to do this.
No.
We might have a big thug bend them down. That would take care of it, but we really don't want to do that. So it just extra work, but
Absolutely, but it's things like that parents that are listening, watching, look for those types of things. When the state says that yes, you can get out, go to the parks, they're really talking about state parks. Go where you can walk, go where you can hike. Maintaining that 6-foot social distance, get outside, walk. There's a Chalk the Walk campaign that's been going around. I know Galion City Schools and their PTO and our office has pushed a lot of things out. Actually, Sidewalk Chalk was pushed out with meal delivery last Wednesday in order to let kids send messages to responders and such. Those types of things are in place to try to get the kids out. We still recommend that you get out, get some fresh air when it's nice enough out. Do those types of things. It doesn't mean go and gather. We're also getting a lot of reports of people inviting people to their homes. You've got to keep in mind that the more people that are in and out of your home, the more people that you're in contact with, the more susceptible you are to infection. You've got to be able to watch those types of things. Highly important there. Same thing, if I had relatives that lived close by, I wouldn't be going over there after work and popping in and out and sending the kids here and there. It's just reducing everybody that you've come in contact with.
great.
Again, because you don't know what some of your friends' underlying medical conditions may be. Things along those lines. And again, I can't reiterate it enough. Would you be proud or embarrassed of the places that you've been in the last 14 days?
Yeah, that's a good point. Hey, FaceTime for the 20th century people out there. That's another thing that I think younger kids, the grandkids, if you will, are very much with it. So if you need this old man's clue on FaceTime, then you're in desperate shape. But that's what we've been utilizing to sort of keep engaged, and we're not terribly shut in. But all right, Matt, what do you got? I know there's got to be questions.
We will do our best to answer them.
Yeah, we do have a couple of questions. As far as the confirmed cases in the county, Cindy asked, how mild or severe are the cases? What kind of symptoms are you seeing?
Again, at this point, symptoms, when we're looking at fever, cough, sore throat, shortness of breath, things along those lines, most of the common symptoms that folks have heard about COVID. Sorry, what was the other part of the question? So signs, symptoms.
And just in general, just the severity of the cases.
Severity of the cases, right now, I can only attest to the Galion case. I don't have all the information, again, with two different health departments. We do have a little bit of a split there in terms of data, but individual is recovering at home under the care of their primary care physician, so that is what we're looking at this point. I will say, though, there are additional individuals that have been tested. They're pending results, so they're self-quarantining till they get the word, are they clear or are they not? And that is within Galion as well, not just the county. So we are waiting to hear back on a few other cases, or potential cases.
Mm-hmm. Okay, and just to reiterate, because we did have a couple of questions asking how many confirmed cases in Galion at the very beginning of this press conference.
Currently, right now, it is one confirmed case. We are pending results on a few additional cases. Again, we don't know right at this very moment how many of those cases are pending, how many people have been tested. If they went out of county to get tested, we still have to wait for the healthcare systems to reiterate the information to us. By law, they are only required to give us that data when it is confirmed. However, most are trickling that information to us to let us know and prepare. And I will say, one of the other things that we are really doing is communicating with our first responders here locally too. We make sure that they know what they need to look out for, where they need to be cautious. We are on the phone constantly with fire, EMS, law enforcement, and making sure that they're aware of what type of personal protective equipment they should be utilizing, and we're all working together as a joint effort. Again, they're aware when they go to a location, if there's a confirmed case staying in that home, we need to protect our responders. That's again why I really implore people to stay home unless absolutely necessary. That stay-at-home order, it is real. It is a punishable offense, and the more we spread our first responders thin, the worse this outcome could be. We need to make sure that our responders are responding to incidents that are imperative that they be there. If they don't have to go out, if I don't have to send my staff out, or Chief Satterfield have to send his staff out to tell people that they shouldn't be on the playground equipment, that's one set of responders that are not there taking care of things that they should be. We have so many other issues that are going on. We really need people to abide by those orders.
Okay, thank you. And another question came in from Mike. He asked, what is the age of the confirmed case in Galion?
The individual's in their 30s.
Okay, and then Ron.
And again, at this point, I will say, because there are so few cases, we are not giving out very specific demographics. Once there are a number of cases, then we will be able to give out, we've had this many in this range, this many in this range, and give out a little bit more. But right now, it's just a little bit too easy to pinpoint folks by giving out a sex or specific age.
Mm-hmm. Okay, thank you. Another question came in from Ron. He asked, are they testing outside of the hospitals?
Some individuals are able to be tested outside of the hospitals. Again, we have, locally we have Avita and Ohio Health providers in this area. Some people do have primary care physicians that are down in the Columbus area as well. Different healthcare systems have set up different methods by which their patients can be tested. So if a physician feels like that their patient needs to be tested, that they fit the case criteria for it, they will send them on for testing. So again, it really depends on your provider, which is why we tell you, if you feel like you have signs or symptoms, contact your healthcare provider. That's highly important because they're the ones that will get you in for testing. Still at this point, you can't self-report or go in and request a test. You need to be assessed by a provider, and what they will do is determine if you meet the criteria at that point in time, and they have to actually write an order for you to be tested.
Okay. And then follow up to that came from Gail. She said, I would like to know how many people have been tested in Crawford County, and then a couple other points to this. How long is the turnaround time to get the test results?
Okay.
And what, if anything, can be done to reduce the result time?
Gotcha. So, all right, so a few things. In terms of how many people are tested, it's really hard to tell. Again, it boils down to there's not the reporting requirement from the healthcare professionals to tell the health departments when they are testing somebody. Okay, so if they were required to report that, we would be able to have those numbers, but unfortunately that is not something that is reported to us to be able to reiterate that out. I'm sure in the aftermath we'll be able to tell how many people were tested, but current time, it's just an impossibility for us right now. Those that are reported to us through the healthcare facilities, if we are told, we are tracking. However, we can't tell you how many people have actually been tested, again, because that aspect is not reportable. Second part of that question was, sorry, you gotta get me one at a time.
Yep, that's all right. How long is the turnaround time to get test results?
Okay, so turnaround time with test results, it really depends on what lab is utilized. For individuals that are in a certain tier, so this again is why it's important for healthcare professionals to monitor and determine their ability to test somebody. But depending on if they are a healthcare professional, if they are working in or living in a long-term care facility, things along those lines, they may have those tests run through like the state lab, so the state health department lab. Those tests are being turned around rather rapidly, so we should be able to get those results within a day or two is typical for that. However, most people don't necessarily meet that criteria, at least that we've had here locally, so those folks are then being tested through private labs. Private labs, again, with our initial persons under investigation that we had, oh gosh, I want to say a couple weeks ago, but I think that was only a couple days ago at this point now.
A month ago, these private labs were set up to do pre-employment testing and for-cause testing, and they were set up to do large volumes of that kind of stuff and switching over. So it is to be expected to tell somebody to be patient. But I think. Do you think that part of the system is they're making real progress in terms of getting the most critically, based on the criteria, the most critically urgently ill, or whatever the right words are, they're getting to the state lab and getting a quick turnaround?
Absolutely, yes. Those that are being sent to the state health department lab do have a quick turnaround. However, the majority of individuals, when we say if you have mild symptoms, stay at home, recover, it's twofold. Number one, the test is only going to tell you so much. That result, that confirmation is only going to tell you so much. At this point, there's no designated treatment. There's no, it's take care of your symptoms, rest, heal, do this. And so the more that you're interacting with folks, with healthcare providers that then may in turn have this go to somebody else, we need to reduce that down. But yeah, with those private labs, it used to be, we were saying on average 5 days. Now 5 days seems to be more the minimum. That seems to be the fast. They are working to expedite that. There are some rapid tests that are in development. I believe some have been approved, but getting the lab capacity to do that does take some time. It's not as easy as some individuals may think. It's not just, oh, here's a test, I have it, it's mass produced as a test. No, there's chemicals, there's mediums that things have to be put into, and also the materials for the testing by the healthcare providers, the actual swabs, and the medium that has to be shipped in. Those are all things that we're working very diligently on with healthcare providers to make sure that they have those things that they need in order to do the tests. And I will say one other thing in regards to testing. A lot of people really want to be tested. If you have minor symptoms, take care of yourself. Stay at home. Do that. Call your provider if you need to. But I will say, anybody that has never had a nasal swab, it's not a fun experience. The swab goes all the way back here. It has to go all the way back to the back of your nasal cavity, where the nose and the mouth meet. That's how far back it goes. It's not fun. You don't want to. You don't want to have to go through that unless it's for a reason. And again, the whole point in how it's determined who gets tested and who doesn't, it really falls down on we need to protect our healthcare setting. Okay? And that is that primary goal, because people are still having babies, people are still having heart attacks, these other things are still happening. That's again why at the state level, regional level, and local level, plans are being put into action now for separate settings. Okay, we're looking at alternative locations for people that have other issues going on. having just had a baby, where do you go to recover? Where do things like this happen? And each system is going to be looking at this. We're looking at alternative sites because we don't need people that have had the heart attack intermingled in with people that are COVID positive. So those types of things, we will have more information on that here. I'm going to tell you most likely before the end of the week, but the way that you look at the healthcare setting is going to drastically change over the next week. It's going to be uncomfortable for a lot of folks, but it's our reality today. The other thing that I will implore folks to do is don't swarm 911. Okay, if you feel that you have signs and symptoms of COVID, call your healthcare provider. Avita has a hotline, State Health Department has a hotline. Call those folks for questions and everything. If you're flooding 911, we're going to bog down the people that need urgent transport. That again also boils down to our first responders, police and fire. They need to be cleared for just those that are true medical emergencies. If you don't have transportation to the hospital and you're short of breath, or you've got somebody in the household that's short of breath, those types of things, yes, call 911. That's what they're there for. That's what they need to be utilized for. But the amount of personal protective equipment that we have on hand, we have to be able to maximize that for the people that are truly urgent medical needs.
So I think yes. I think that is keep up the way folks have been doing, not bombing 911 with a bunch of calls or making less than critical EMS calls. So I think I've not heard that from either of our safety forces. So keep up
Keep it up.
that level-headedness and common sense. And if Matt and I've been doing this for a couple of years, I can usually tell when he's got a question.
Absolutely.
You got a question?
I'm sure there's plenty.
All right, here we go.
Sure. This next one comes from Tommy. He asked, is there any chance of a total lockdown in Galion like Mansfield is doing? And then again, going back to this whole situation where a lot of families are going places together still.
Yeah. I don't I don't anticipate that. If it were to become a problem in the community, really Trish is going to be the one that's going to recommend to the local safety forces that you're going to have to step it up. So I'll offer my opinion, and she's actually has the black robe on this one. It is eerie how quiet it is, for instance, on Harding Way. I've never seen anything like that. Similar might be if there's 1.5 feet of snow, but I'm of the opinion and the thought that people are doing really a pretty good job of staying off the street, staying in, minimizing their trips. But the second thing I would say about that is in the last couple of days, not unexpectedly, but statistically expectedly, you're starting to see a number of cases. We were hanging with none for a while, and talked with some people who thought we might be a low-risk county if the federal kind of phasing out of the stay-at-home stuff. We're seeing that kind of escalation in identifying cases that has to do with getting test results. It also has to do with the spread, that community spread. You're starting to see that. So we can't ease up, but I don't know what we would lock down exactly. I think what we're not going to do, and this comes from Chief Satterfield, is the GPD is not going to use as the old license plate light is out, I'll stop this guy kind of thing. So we're not going to go shopping for people that are out driving around and looking for some other violations. We got enough work to do without that sort of thing. So some people I think are kind of concerned about that and just going from point A to point B and I get stopped for something. I don't see that. So I'll stop there. From the city enforcement point of view, no. Do we see the necessity? Maybe the more important thing that would drive a change in policy would be, we're seeing some signs that people are ignoring it. So anyways, I'll stop there. Go ahead,
I will say,
Trish.
we don't want to get to that point. That's the easiest response that I have is we don't want to get to that point. If people will follow the stay-at-home orders, we should not have to get to that point. And what Tom alluded to, yes, Harding Way, there's not as much hustle and bustle. However, I did personally have some serious concerns, even last Wednesday and Thursday, the amount of foot traffic, the amount of people that were out and about in the city. Until there was a case in Crawford County announced, then I believe people started to take it slightly more serious. And it's understandable. This is not like other disasters or emergencies. It's not something that's easy to see. You can't see a facility down from a tornado or whatever. But I think for individuals hearing that it's within their community, hearing about somebody that knows somebody, or you personally know somebody that has contracted this, it doesn't always quite hit folks. So I think that people understanding that it is here, the lag time, that wait time that we have in getting test results in, we are going to see more case numbers. But please don't get so focused in on the numbers, because as we've reiterated time and time again, and I know Director Acton and Governor DeWine have reiterated this numerous times, not everybody's going to get tested. So don't focus in on the numbers. It is here. Do what you can do to reduce the spread.
All right, Matt, what else? We got more, I'm sure.
Just one other question.
Good.
This one came from Julia. She just wanted to clarify, what about going out and taking walks?
Absolutely. Go take walks. I love it. Take walks. I know they're, the big thing is 6 foot of distance. Okay. If you're taking a walk with somebody from your own household, okay, you can walk alongside them. Don't meet up in groups to take group walks. Don't meet up with your neighbors, things along those lines. I mean, you need to keep that 6 feet of separation. Again, that's the big thing. 6 feet distance. If you are walking at a park or walking from a park to here, or walking to pick up some food uptown here, something along those lines, go for it. Take a walk. Fresh air will do you good. I think everybody will get cabin fever, especially as we go on with this. But yes, you can take a walk. You can go out, get physical activity. You can be out in your yard. You can do things like that. It's a matter of don't have a bunch of people over. No barbecues, no tailgates, things like that. Don't go doing that. Don't do the meetups, the play dates, the sleepovers, especially, we're hearing a lot of teenagers.
Right.
Oh, well, I'm just going over to my friend's house. No, because here's the thing is, if you have somebody over at your home, how many other people in the residence that they live in have been exposed to these people and these people? So it's that trickle down effect, and that's how things spread like proverbial wildfires.
So, take a walk. I think the one rule of thumb I've heard, I think still valid, is it's this more than a few minutes contact. I think by and large, the cashier you run into, the person that you go past in the grocery store and maybe bump shoulders, that it's not that contact that I think we're so worried about and want to be cautious. It's when you're engaged in conversation, short distance, or if you were walking with somebody for 15, 20 minutes, and as Trish was saying, you met up with them, you don't live with them, then all of a sudden everything that they bumped into and everything that you bumped to are going to bump into each other. So
We are. In addition, I mean, We do have the concerns when you're out at the stores and such, which is why, I mean, even my little sanitizer here, making sure that you're washing your hands, not touching your face, things like that. Because if you are touching the grocery store, the shopping carts, the buggies there, that type of thing, yes, this virus can live on surfaces for a period of time. So if somebody sneezed on that cart and you're touching it and then you're touching your face, you can contract that way too. It's not always necessarily person to person there. So it is important to be very cognizant of your surroundings, and again, only go out for the essentials.
All right, you tired of hearing from Trish on that one? How many times can you tell somebody important information they probably really don't want to hear, but till we're blue in the face maybe, but the message isn't changing. You just got to stay with it. Do we have any more questions on that?
No, that is all.
All right, as I touch my face one more time, you get real self-conscious about that, particularly if you have that bad habit. I want to just mention something else. We have somewhat of an audience, and make it quick. We've all been in our own ways trying to contribute to this. All of us in public service, public health, and local government. We just posted a 11-page summary of the legislation that passed Friday. I think it's very important for all businesses certainly to take a look at that, and begin to understand how that's different than legislation that was passed earlier in the week that dealt with extended unemployment, and I think many of us have heard of the difficulty getting on that unemployment system. Having spent a little over 5 years in that JFS system, it doesn't come as a great surprise, but I think they're trying to get that accomplished. But for every business and self-employed person, 1099s, very small businesses, up through small businesses that are familiar working with the SBA. Don't turn off the TV now, or it's going to be really very important that you get a handle on the new legislation that passed Friday. So I warn you, I'll be back on at some point in the next several days. There are a couple things I want to mention to talk about the legislation. Things that I know, and you'll find out soon if you're just getting introduced to this. There is no application. It's being worked on. There's hope that there will be an application that one can fill out on by the end of the week. However, the information that you need, you can find out what that is. And a lot of it is the kind of information, we're told, that you already have put together as a small businessman or independent contractor, independent small business person or independent contractor. And so you need to start to pull that information together. Plenty of concern I've already heard about SBA. You don't have any idea, O'Leary, you've never filled it out. It's very paper intensive. I know that's the reputation. I know also that they're working very hard to put out something that enables a quick turnaround. So all we can do throughout this week is get the word out about it. Please trust me, we're working with the local banks and with local accounting firms to try and get as much information out there to small businesses. So exactly what form that takes and whether or not we can set up some small tutorials to enable people to go through the application as it's developed, time will tell. But first thing you need to do, if you're concerned about where your business or your independent contracting status is heading, and you're committed to that profession, unemployment doesn't seem like the best way to proceed. Take a little bit of time, look at the CARES Act, look at the high points, and then please stay tuned to other Facebook Lives and YouTubes, I guess, where We have a YouTube channel, Matt tells me, but stay tuned to this vehicle, however you pick it up, to get more information about when and where we're gonna try to provide assistance to small business people. And gee, just about everybody in our community qualifies as a small business person. And so that's really kind of the message. I guess we have a question maybe, so I'll try to.
Yeah, we have had a couple new ones come
Yeah,
in.
okay,
Alright.
go ahead. Going back to health?
Yes.
All right, so I'll stop there. People worried about their individual health more than the health of their neighbor's business. Oh my God, I can't believe it. But anyway, it's going to be real important. What we want to try to do is keep people employed through this program. This is running for 60 days, so my experience tells me that if it is utilized by businesses, after 60 days, if we're still in the public health emergency, that there'll be some additional resources, additional cash available, and certainly can't hurt to get the information together, get ready to get in line, and then strategize about what's the best way to get through the that narrow gate that will probably be the SBA's ability to process applications. So, all right, back to public health,
Okay.
please.
Next question came from Samantha. What about the employees who touch products to put it on shelves, deliver to people, that sort of thing? How many people are touching products in general? Is that not a concern? Are
It
those
is.
employees wearing masks and those sorts of things?
It is. Again, so first I'll start where you ended in terms of employees wearing masks and such. Masks are kind of twofold. One, they're only as good as if you're wearing it properly, and most people that are not used to wearing a mask don't wear it properly, or it makes them fiddle with it and they're touching their face a lot more than they would even normally. Don't wear a mask unless you're sick. That's the other thing is healthcare professionals and first responders are wearing masks when they believe that they're going to be coming into contact with somebody that could potentially have this. However, if you see a few select people also wearing them, they may either have been told that they need to wear a mask because they have something else going on. It could be COVID, but if somebody has an underlying medical condition, if they are immunocompromised, they may be wearing that because they are aware of their risk, at a higher risk, that if they do come in contact with respiratory droplets from somebody else that does have this, that their system cannot fight it and they will be more adversely affected by it. That it's something that could kill somebody with certain underlying medical conditions. So please be very cognizant that just because you see an individual wearing a mask does not necessarily mean that they have it. Let's not start stigmatizing masks that way. People that are protecting themselves due to underlying medical conditions, that's what they're told to do. And again, that boils down to don't wear masks unnecessarily. The people that need them, for every person that is wearing a mask unnecessarily, you're taking a mask off the shelf of those that need them, including first responders, healthcare professionals, and those that have underlying medical conditions.
I think, go ahead.
But back to the original question there, in terms of items that you're touching on the shelf. Your shopping experience should be slightly different than normal. You're not touching every single box and picking everything up. Go in, get what you need, grab it off the shelf, put it in the cart. Me personally, I sanitize every single time I pick a different item off the shelf and do something like that. Again, not everybody has the ability to do that. But if you are getting your groceries, making sure that your cart's cleaned off, get your groceries, put them in the cart, pay for them, take them home, put them on the shelf. Again, whenever you get home, wash your hands as soon as you get in the door because you don't know all the surfaces that you may have touched. Disinfect the car handle, things like that. I mean, think about all the places that you touch. Wipe those things down. Do what you can to reduce the spread.
All right, complete answer there. I think going forward, because we're not killing this virus.
Right.
Hate to be the bearer of bad news, but as it subsides and it's in the pandemic aspect of it goes down, you're going to see a lot of changes in behavior.
Absolutely.
You know, in terms of what when there are enough gloves to go around, so to speak. You know, I suspect we won't see anybody handling produce in a grocery store setting without having some gloves on. Those kinds of things will be interesting to see, the social distancing, how long that's takes effect. But I think Trish made a good point. For now, masks and gloves, that kind of PPE, is really in short supply. So I didn't hear that didn't read that into Samantha's question, but you know, expecting the lady or gentleman reloading the produce or stocking the shelves with something that's in a sealed container, I think that'll be a long ways to go.
Yeah.
Well, just one more point. I don't know much about it other than we've worked with Next Gen a little bit over the years, and the extent to which packaging of foods in the U.S. is really on the side of safety. I think that benefits us as compared to other countries in terms of from the farm to the table. I think there's quite an emphasis on safety even prior to this. So, all right, we have another question. Stop talking about stuff you don't know anything about, Tom.
No, just a suggestion
please.
on this topic from Michael. Be careful with fast food. Cashiers rarely change their gloves between customers, so you're touching everyone else's credit cards and money.
Yeah, I think that's true. Who's that killjoy, Michael? Tell him never to call in here again. No.
But yeah, I mean, again, anything that you touch on a regular basis, you know, I believe the last time we were here, we were talking about door frames and parts of the table and chairs and things along those lines. But yeah, I mean, you use your credit card regularly, wipe it down. You know,
Absolutely.
It's anything that somebody else touches.
Okay, we can add to the list the guy and gal at the pharmacy. So I do believe, without making any, it's not facetious, not silly topic, but I think as a number of gloves, there's a worry, not a panic, a worry about, you know, adequate supplies of those things for nursing home workers, emergency department people, and the medical employment chain that I think around the corner will be, you'll never be able to buy a hot dog at a ball game if the dude does not have gloves on. I think that's kind of how it's been going the last few years. But a lot of those things are changes. They're inevitable. I think we'll all adjust to them. We'll all be happier, you know, in the long run. But anyways, if there aren't any more questions, I think we'll wind this up and say, stay healthy, hang in there. I will keep you informed intermittently, particularly as numbers change, to try to keep you informed, anything in particular about the local health departments, interventions, and what they need help with. And then, as I said, just as a quick preview, we really need to emphasize that small businesses take a look at the act that was passed, called CARES Act, passed on Friday. The rest of the stuff may be not business friendly. We're really hoping that we can make this business friendly, because wages continue for your employees, and there's provisions for loans that turn into grants. I know there's business person skepticism about that. I mean, it's like turning a frog into a prince, but we really have to do the best we can to trust in government a little more maybe than usual. We're all going to be out in the cold. I don't want that to happen. So, all right, enough droning on, begging for questions, and trying to fill up a certain time span. Trish, thanks a lot. Bad news, but overall we're going to have to keep on working. Young people, you're 60% of the folks identified in the county. Like, all right already, you know, help it out, help yourself out, and don't waste a bunch of time trying to play whodunit with who this individual is. There's a bunch of wasted energy. Why can't you tell us? I don't know. What do you want to go over and put a scarlet letter on them or something? It's like, hey, they're resting at home, recuperating at home. Enough already. Leave it alone and do something else with your Facebook time. God bless, and thanks again, Trish. See ya.